let's try Courtney's question. What to do for oversupply issues when the routines want you to express so much? I have had mastitis and multiple blocked milk ducts, but the routines and this forum are adamant about expressing, which I don't understand.
So when Courtney says this forum, she means the Save Our Feet.
She does, yep.
Well, that's a really hard
as well,
question to answer just without actually talking to her, because the routines in the first few days, we do say to express. So I say that you have to express on the routines to cover growth spurts. So when you...
So clever.
So when you're feeding your baby, if you're feeding them a set amount, your breasts get used to this set, not a set amount. When you're feeding one baby, if the baby feeds for like 25 minutes, and when we say 25 minutes, we mean 25 minutes sucking time. So you might do 3 minutes, take them off, burp them. 3 minutes, take them off. It's 25 minutes sucking time, not 25 minutes from the start to the end of the feed. Yeah. And then if you're feeding your baby, then at some point your baby will have a growth spurt, they need more food. But because our bodies are like dairy cows, which I often get contradicted for saying we're like dairy cows, your body ends up making a set amount, which is really good and stops engorgement.
Yes.
But if your baby has a growth spurt, there might not be enough milk. So I say in the routines, and people often say in routine, it says express 30 mils, the next routine says 60, the next says 90, and the next says 30. That's because when you go down to 30, they're roughly having a growth spurt and the extra milk's in your boobs to feed them.
Okay.
So you need to express to cover the growth spurts. Now, when someone says they've got engorged, I always want to say, did you follow the feeding advice in the hospital? So did you put the baby on each boob for 3 minutes in the first 24 hours, and then 6 minutes in the next 24 hours, and then 9 minutes in the next? Or did you put the baby on and let them suck? Because how you normally get engorged boobs is you've put one baby on and let them suck to the point where your body thinks you've got a 1-year-old who needs a 5-hour feed. And you end up, when your milk comes in, having so much milk because your body thinks that it needs all this extra milk. I'd love to work out why your body hasn't worked it out yet, but it hasn't.
After all this time.
You know, because like what used to happen in society that was different, I don't know. But, you know, was they always did routines, and have we suddenly gone away from that? Like, was the old wise tales, like you said earlier, that this land has been used for, 70,000 years? So 70,000 years ago, did the old wise woman in the are they, can we say tribe? In the family, did she tell a woman only to feed for 3 minutes? Have we just gone back to old-fashioned advice? So I want to know, did this Courtney lady, mum, did she really follow, or does she think she followed it because she just thought, well, I'm going to do 3-hour feeds in hospital? Like, you know, because I don't think she could have actually truly followed it and then ended up with engorged breasts. However, out of 1 in about 300 people, yes, somebody might follow it, and they might have followed it exactly. And they might, for some reason, end up with engorgement. And then you need to seek medical advice, because that's not normal. If you have followed the routines from day one and followed the times, you should not end up with engorged breasts. And if you do, you will need to express for comfort. It's so important to not go, I've got really engorged boobs. Because let's think about it. You've got no milk. Then your milk starts coming in and your boobs get bigger and bigger and bigger and bigger. And then you end up with all this milk. And then all these people say, including myself, oh, I've got so much milk, I'm so engorged. And then they stop the expressing, they stop this. And then
I did this.
Is it 6 weeks? They get to 6 weeks and their body suddenly goes, oh, I've worked it out. We've got 1 baby, in your case, 2 babies. We don't need that much milk. Vroom! And it pulls the supply back. And it's like, so you get kind of engorged about 6 weeks, and then suddenly your supply drops. And then you don't have enough milk. So yes, you do need to express. It's so important to express. And if you don't want to express and follow my routines with your first baby, by the time you have a second baby, the expressing isn't as important.
Why? Does that mean I don't have to as much?
Get used to the milk. You've sort of got more of a feeling of what your boobs, and they get used to it. You still should, but it's not as important. You might find that you can express a little bit less. It's like your body gets more used to.
Sure.
You know, the first time you're feeding a baby, you really need to help your boobs bring the milk in
and learn what to do. Right. Okay.
So then, if you're not going to express, don't follow the routines minute by minute until 8 weeks.
Okay.
So don't follow them until 8 weeks if you're not going to express.
What to do instead?
just roughly follow them.
Okay.
Use them as a guide,
Okay.
you know,
All right.
and because you may need to feed your baby more. Or actually, the other thing is that topic that we really get in trouble for talking about. You could give formula. So if you don't want to express and when your baby goes through a growth spurt, you could give your baby formula. But then you've got to be really careful because you need to give formula at the same time every day. So you might find that when you first give all of these people say, or give the baby a bottle of formula at the last feed at night. That's a stupid thing, silly thing to do because a baby when it first has formula gets really hungry.
Okay.
So they're going to wake up in the middle of the night more hungry than normal. Right. So you would give formula at the same time every day. If you don't want to express, you could give some formula at the same time every day. But just watch out for your baby getting unsettled at night. They might get hungrier at first and it will pass. It doesn't mean they're intolerant to the formula. And we have on our website small tins of formula. Like we have little 400-gram just-in-case tins. We're the only people who do them as far as I know. So most people have 900-gram tins, but we do these little small tins so that when your baby's first born, you can just have a little small tin. Or if you're only using formula once a day or you're only using formula in your baby's solids, we have these little small tins. So look out for those.
Yeah, fantastic.
Well, that's it, I think. We will talk about crawling in episode 6.
Yep, look forward to it. Thanks so much, Tizzie.
Happy Mother's Day to everyone.
Happy Mother's Day.